I'm Kate Blessing, and I work at Martin Luther Campus in Bloomington, and I'm the Director of Community Relations there. And we are an Ebenezer managed community and a part of Fairview Health Services. And so for those of you who might be new to our campus, we provide trusted quality senior care to seniors and others in Bloomington. And in 2021, this coming year, it will be our 60th year of walking alongside seniors and their families as we provide this care. And it's really a privilege and an honor to all of us to be involved in the lives of folks in this way and be a part of this part of their journey through life. And so one of the things that we're really proud of is the longevity and the expertise of our team. In fact, we've got many, many employees that have been on our campus for 20 plus years. One of my colleagues just celebrated 32 years at Martin Luther Campus the other day, and that really is not uncommon. A lot of folks that have been on the team a long time, and we've got a solid group. And so when things like COVID come along, we know how to buckle down, work together, and make everything safe for everyone. My colleague who will be talking in a few minutes, Amy, calls us a fortress because we're locking everything down and we're being as safe as possible. So those are the times when we're extra proud to be a part of the Fairview system and to have the support of one another as well. So if you are new to our campus, we provide a continuum of care services to meet the current needs of folks as well as the future needs. So you may have heard the term age in place, and that's part of what that means. And so we provide assisted living and memory care, long-term skilled care or nursing home care, short-term rehab care, and then we have an adult day program as well. Just so that you know, we do have immediate openings in our assisted living as well as our adult day program. So if you have an interest in talking more specifically about that, I can always put you in touch with a staff member to do that. A couple of housekeeping items for today. Amy will be presenting the information, and I think you saw on the registration that it was for about an hour or so. And then we have a portion at the end, and Jennifer from the Normandale Center for Healing and Wholeness, they will both present, and then we will have time for questions at the end. But I know it's hard to remember questions all the way through to share at the end. So if something pops up for you, just type that in the chat field along the way, and we will make sure that it gets addressed at the end when we go through. So fill that up as much as you'd want with anything that comes to mind. And then if Amy covers it, we'll just pass it by at the end. And if you need to know how to do that, when you're in your Zoom screen, if you hover your computer, your cursor at the top or at the bottom, a ribbon will come across with some menu choices on it. One of them says chat. You can click on chat. An extra box will come up and you can type your question right in there, and it just saves it over on the side. So feel free to do that along the way. We welcome that. And as they say, if one person has a question, more people do too. So thank you for bringing those forward. Now I'd like to transition into today's topic, navigating senior care during COVID-19. And Amy James is our speaker. She's my colleague at Martin Luther Campus. There she is waving. She's the Director of Sales and Outreach for our Meadow Assisted Living and Memory Care at Martin Luther Campus. And she has a vast knowledge of this topic of senior care, what to do, what to ask for, the levels of care, payment options, what are the things that should rise to the top of your list when you're looking, all that kind of stuff. And I find her to be an incredible expert on the topic. And so she's got 20 years of experience in the marketing outreach field. The last 4 of those she's been at Martin Luther Campus. And she's very passionate about seniors and supporting seniors and families, which I think shines through, as you'll see that in a minute when you hear her talk. So I can't sing her praises enough. She also holds a certificate through Leading Age, which is our kind of senior professional group across the nation and in Minnesota here in that sales and marketing area. So she's well-versed. Additionally, we are lucky to have the partnership of Jennifer Monroe at Normandale Center for Healing and Wholeness. Normandale Center for Healing and Wholeness, which is in Edina, and you might know Normandale Lutheran Church, and they are located very near there. And a great organization. They provide wonderful guidance and support to seniors and to families and to caregivers. And Jennifer will be coming on later in the presentation to give you more information about the organization and some of the important work that they do in the community and ways that they support seniors and families. So I will let her dive into that more when we get to that part of the presentation, but we're really happy to be working with Jennifer as well. So now I think we want to turn things over to Amy so that she can take it from here. And I will just flip over to my screen here where we're sharing, and then we will go from there. Okay, screen sharing, here we go.
I'm doing a microphone check. Can you hear me?
Oh, do you want to turn up your screen?
Yes, I can hear you.
All right, thank you. All right, I'm Amy James. I'm the Sales and Outreach Director at Meadow Assisted Living, which is located on the Martin Luther campus. These slides that we have, we will email out to you if you'd like. So you don't have to take notes, you'll get them. But I'm gonna walk through them. So making informed decisions, that's what we're here to talk about today. I'm gonna talk about the levels of care first so that we're all kind of on the same page with that. When is the right time to plan a move? What type of care is available? How to begin the search during COVID-19? Cost, I will cover that. And what other things should I be thinking about related to a move during COVID-19 or in and around this environment we find ourselves in? So when is the right time to plan a move? Now. You can't plan soon enough. Talking about it with those that you love, putting together the healthcare directives, power of attorney, you can do that work now and be setting some things in place. Some things to think about if you're working with someone who needs a move or a friend, neighbor, relative, or you yourself. These are some things I'm looking for as a salesperson when I'm talking with the daughter. We don't know if it's the right time for mom to move. Well, how's their health? Is it deteriorating? Is it taking a longer time to recover from an illness? There might be a chronic condition that's getting worse. Weight gain and weight loss are huge indicators. Difficulty participating in things that they have normally been able to do on their own. The social life is a really good indicator also. If someone has had a lot of friends, they've been able to connect, they pick up the phone to call people, but they're not doing that anymore. And maybe their hobbies and interests have kind of have dwindled. They're not getting out of the house as much and just kind of slowly becoming isolated. They're kind of withdrawn a little bit. That's an indicator. Nutrition for sure. If nutrition has changed, and as I talk with daughters and sons who are worried about their parents, this weight thing, they're losing weight. They eat toast, bowl of cereal. They maybe make a sandwich. They're not eating real food, or it's all microwavable food, or maybe you open the refrigerator and I'll ask a daughter, well, what does their pantry look like? What's in there? And if it's all expired, things that aren't getting used quickly enough, then that's a good indicator also that they might need a little extra help. Maintenance of the home is obviously an indicator if things aren't maybe as clean as they used to be, or the housework just isn't something they can handle anymore, a vacuum, or getting up and down the stairs to do the laundry, or shoveling snow. So those are some things to think about too. One big indicator I always ask about kind of at length, we'll talk about how does not driving anymore impact your person or you. So if you're not driving anymore and still in your home, what are the supports that have been put up? Are they enough? Do we need more? And is that sustainable? It usually is fairly isolating over time once you're not driving anymore. So those are the indicators I look for when I'm talking with families, or that families bring up that they're worried about. So a good start to thinking about this. I'm going to walk through the kinds of care available first, and then jump into some what to ask during COVID kinds of things. So we'll go from the least amount of care to the most that's available. So independent living is a kind of a broad description. Independent living could mean living in your own home or living in an apartment, but I'm going to talk kind of specifically independent living in the care world is usually about living in a cooperative, which is a senior building, 55 plus. So what that provides usually is a building that has maybe some extra security, wider doorways, some amenities like maybe a beauty shop, and certainly usually a council of people who live there who are doing some social things. So it's pretty interactive. You could just imagine if somebody's living in their home and they don't want to do the housework anymore, their choices would be like a regular apartment or townhome or a senior community. And the regular apartment or townhome might be okay, except that there's probably a lot of professionals or people with young children, so you might not find your peer group. So that's what these cooperatives or independent living communities are really good for, is you're living with a whole building of peers. So you find your people, which can be hugely beneficial. So the cost for this is usually just the cost of an apartment. You're buying into it, so there's an outlay of funds first. Maybe over 100,000, maybe over 200,000, depending on how fancy or where they are. And then you would pay a monthly fee to stay there. But one of the benefits of this is you can lock the door and go to Florida. So it is that secure and that kind of community. So it's very easy for someone who maybe does have a second home for the winter or that kind of thing. So that's a benefit. When you're buying in, though, just know that you have to sell when you leave. These are fairly desirable living arrangements at this time, though. So the selling, I have not seen be an issue. What's also notable, so the monthly fee is going to be like a normal apartment rental rate for that monthly fee. So it's in line with what you would be spending for a normal apartment in, let's say, Bloomington or Edina or Richfield, plus that initial outlay that you would get back when you sell. The staffing, I'm going to go through cost and staffing for each of these communities, because that'll really lay out for you what they're for and how they work. So in an independent living cooperative building, typically there's only two staff. There's a housing director and a maintenance person. And you might have a part-time housekeeper cleaning common areas, but it's an apartment building. That's what they're doing there. So any extra help that's needed, if you're having meals brought in, you might be able to have delivery from Lund's or Target, or maybe your family's bringing some things in. You can hire out housekeepers, but they're coming in from the outside. They are not employees of the building that you're living in. What's nice about this right now during COVID is independent living is not regulated as a care facility, because it's not a care facility, which means families can come in. Anybody can come in. You can have the housekeeper come in. You can contract with anything you need to bring that things in and out. Whereas care facilities are being very tightly regulated with visitors and what can come in and out of the building. So this is as close to living at home, but without having to take care of the lawn as you can get. All right, moving to assisted living. Assisted living, there's a write-up here I did on this, but this is for senior community, 55 plus. And the way I like to describe it is first an apartment building, kind of like independent living, with care. And it's as much care as you need. So you can layer it on as much as you need, or maybe I only need help with showers. I'm getting a little shaky and that makes me nervous. The cost for assisted living, because you have a full staff of care, your meals are provided. There's a housekeeper that's cleaning your apartment once a week. There are amenities in the building typically, as well as the socialization, but you've got a nursing staff and you've got home health aides or resident assistants in the building. You get a pendant when you move in to push to immediately have someone come in and help you. If you've found yourself on the floor, or you're stuck in the bathroom, or you think you're having a heart attack, or you wake up and don't know where you are, you have this pendant to push with a whole staff of people there 24 hours a day. So cost for assisted living, if you need care, is going to be in the $5,000 to $7,000 a month range. And I'll say that, and I'll qualify that with, if you're in a studio apartment and you don't need as much care, it could fall below that. So it could be closer to the $3,000 to $4,000 range, but usually when you're moving into assisted living, you are needing the care. You're not moving in for fun, right? So to budget, I'd say $5,000 to $7,000 for assisted living once you need that. The staffing is very different. So the staff, we have a full staff of housekeeper. In our building that has 113 people, we have 3 housekeepers We have 2 maintenance staff. We have a host of receptionists that staff the front desk from 8 a.m. to 8 p.m. Monday through, 7 days a week. So I think we have 6 receptionists, a housing director. I'm the salesperson, an activities director with an activities staff. And then our nurses, we have 3 to 5 nurses on Monday through Friday, 8 to 5. 1 nurse on Saturday, Sunday, like 9 to 3. The nurses on all other hours are on call, so available but on call. And then our resident assistant staff is 24 hours, so in the building all the time. So we are there for anything you need. I like to talk about, assisted living. Someone can walk in the building and not need anything, but just know that they have that pendant and that meals are being made and I don't have to care for my home anymore. That's like the light side of it. Our highest served person in our community has had a stroke, and he has lost use of half of his body. He is in a wheelchair, and we help him dress and groom in the morning and in the evening. At this time, we are also assisting him with cutting up food for meals. We're doing his medication management, making sure he gets his meds on time. So really, everything that he would need, we can provide in an assisted living. And I tell you that just so that we can talk about what it means to move to a nursing home. So a lot can happen in assisted living before you need nursing home level care. Reason someone would move into assisted living right now, the stories I'm hearing right now are our daughters or sons are trying to maintain their mom or dad in their home or have moved mom or dad into their home during this COVID season. And we're getting into, this is becoming a long journey. And maybe mom or dad has seen a little bit of a decline, but also daughter or son is trying to get their own kids off to school or doing online learning at home while they're trying to maintain a job, while they're trying to care for mom and dad, or get over to mom and dad's house every day, twice a day to just make sure things are in order. And that just for the long haul isn't sustainable for anybody. So what I'm seeing right now, people aren't, they've held off moving into assisted living and done as much as they can for as long as they can. But most assisted livings are starting to hear the phone ring right now. And I'm just telling you the trend so you kind of know. And we're prepared to receive those calls. We are doing move-ins and we're ready for that. And we'll get to the safety things that are in place that I want you to know about. But that's kind of what's common right now. I'm going to move to memory care next. Memory care is usually housed in an assisted living building. So everything I've said about assisted living applies to memory care also, except that it's a secure wing of a building. So a memory care wing has a controlled entry. So resident can't leave without an access code or without an escort. The reason for that is to prevent wandering. But memory care functions very much like assisted living. You have your own apartment that you can decorate any way you want, just like assisted living. It's an apartment that's yours. You bring your own bed, you bring your own pictures, and we support you throughout your day. In memory care, we don't provide a pendant. So in assisted living, you are someone who is directing your care, and you know when you're going to get your shower assist, and you know when the meds are coming. In memory care, you might not remember these things, and you might not remember you have the pendant. We're there to remember for you, and we're doing rounds every 2 hours and doing safety checks in the overnight. So those are the kinds of things that memory care is good for. We are shepherding people through their day to make sure that they're eating, make sure that they're have things to do. So activities level is at a much higher place. Even now, where we have 7 days a week activities, most memory cares have sustained that. And in memory care, we're dining together. So that hasn't been the case through COVID all the time in assisted living, although most places have gotten back to the dining room, at least for one meal of the day with plexiglass. Memory care, we've just kind of continued. They're communities unto themselves because they are wander guarded. Staff usually in a memory care are pretty dedicated to the wing that they are in. So at our building, our staff are very different. We aren't switching floors. The same Monday through Friday staff are always the same Monday through Friday staff. The evening staff are the same, and the weekend staff are the same. So the hope is that for the 14 folks in each of our 3 memory care units, they're smaller units with fewer people in a smaller part of the building. So a person can feel like they aren't lost. And they do have a chance at remembering the other 13 people that they are living with and dining with and doing activities with. There's just fewer faces, which would be less overwhelming. So the staff ratio in our memory care, and we're an Ebenezer property, this would be an Ebenezer standard, would be a 1-to-7 ratio for daytime, so 6 in the morning to 10 at night. And then 1-to-14 overnight for our RAs to our residents. The cost for memory care is higher than assisted living because you've got higher staff. So most of the time when I'm talking about cost for these things, it's about staff. And that's why I put them together a little bit. So the cost for memory care, I would put in Minnesota in the $6,000 to $9,000 range if you're budgeting, with $6,000 being kind of on that studio side, I need less care. 9,000 being on I'm maybe wheelchair bound and maybe a larger apartment too. I will say that there are some very beautiful, very new, very nice facilities where it can go higher than 9,000 and get closer to 10, 12,000 also. But that just kind of depends on what community you're looking for. One other thing to note is there are some memory care locations that are standalone, meaning it's the entire building is memory care. They tend to cost more because they tend to staff at a higher level. So places like the Wheelshire, Moments Memory Care, the 2 I can think of off the top of my head, they will, like I say, staff at a higher level. The building is still broken up though. So it isn't like a person has full run of the building to walk everywhere. The building is broken into pieces by care levels. So it is more leveled care where, folks who are all able to still walk might all live in the same place so that we can all do some more active things together. And folks that maybe are less mobile, we are doing more sitting activities together to keep people energized and connected during the day. So what I will tell you, why someone might move into memory care, particularly now, if someone needs memory care, right now, a spouse is probably caring for that person or a child and having to live with them in most cases. And what happens to the person who's living with someone with cognitive loss is the person with cognitive loss will sometimes experience sundowning, which is afternoon to early evening. That change in the day can get very difficult. And of course, it's at the end of the day for the caregiver. The caregiver is trying to make dinner and get ready themselves for a night's rest. And then if you have someone who has totally mixed up their days and their nights, then everybody's backwards and the caregiver is not sleeping at night because they're having to keep the person safe and not walking out the front door at night, but then they also aren't sleeping during the day either because it's tough. So I will say that longer journey of caring for someone with memory loss at home, what can happen is someone who was a very loved spouse or daughter or son becoming the caregiver, it can get out of whack, the relationship. And there can be some resentment that happens. So when those negative feelings start to happen, that's when it is a good time, if you can do it and navigate this to begin to think about memory care, so that you can be back in right relationship with your mother or your father or your spouse. Letting a facility be the caregiver puts the family back together again the way they should be. And you can just love on your person and let us do the heavy lifting of the caregiving and staying up all night with them because that's our job. So that's memory care. Moving on to care suites or enhanced assisted living. These are 2 names for kind of the same thing. And enhanced assisted living and care suites are nursing home, almost level care in an assisted living. So the places that will have care suites or enhanced assisted living are going to be standalone assisted living facilities that are not like the Martin Luther campus. The Martin Luther campus, we have a whole separate building. It's our nursing home. So when we get to that level, we'll be talking about a move to the nursing home. But if I'm a standalone assisted living, we as a team might decide, okay, part of this building, we are going to dedicate 6 rooms to a higher level of care with a dedicated staff, a dedicated nurse that almost resembles, emulates what nursing home level care looks like in an assisted living, so that, and the reason a person might choose this is so they don't have to move again. Not all assisted livings are able to provide this, and you have to look for them. So they aren't everywhere. So asking for them by name, though, this is what they're called. What the other benefit would be, you have all your own furniture in an apartment, but with that higher level of care. It's a more home-like setting than a nursing home, which could be suitable. So staying in the same building, or maybe it's location. Maybe the care centers or nursing homes are not close enough to the daughter. So the daughter wants to find the closest enhanced care so that mom or dad is just across the street or as close as they can be so that she can visit, kind of a thing. So those would be good reasons to look at care suites or enhanced living. So higher level of staff is going to be staffing almost like a nursing home, like 5-to-1 staff ratio. And then the cost of this is going to be top end assisted living. So $9,000 to $12,000 probably. Depending on care needs, and that gets close to what nursing homes are. So the next slide is skilled nursing and long-term care. Now, all those things are the same thing. Skilled nursing facility, long-term care, a care center, nursing home, they're all the same thing. And what that means is they're regulated, the assisted livings are regulated, memory care is regulated by the state of Minnesota under an assisted living license. Skilled nursing is regulated by the state of Minnesota under a skilled nursing license. And what that means is you have skilled nurses 24 hours a day. So higher staff level with the staff has more education. They might have some specialization and in particular to the facility. So at the Martin Luther campus, we are trained in having folks who have an LVAD, and not all care facilities have that. So kind of knowing the care that you need is helpful to choosing a place that's going to work for you. I had a call within the last few months of a person who was clearly assisted living level care, didn't need a whole lot, gets around on their own, can dress themselves, but they had the LVAD. And we don't have that in the assisted living. So they are automatically nursing home care if they can't live at home anymore for some reason, because a person needs training. So this is the highest level of care available aside from a hospital. Nurses are on 24 hours a day, 7 days a week, along with resident assistants. It's a full staff, meals are included. So the cost, we quote almost everywhere has kind of the same regulated cost levels because the state is regulating this. So it's $400 a day, typically, give or take, which is $12,000 a month. It can go higher if there's some specializations that you're needing. So what a skilled nursing facility is for very complicated, serious and chronic health conditions. Those who can no longer bear weight on their feet. So if a person can't stand up to pivot to help transfer, and we have to use what's called a Hoyer lift or an easy stand, those things, if someone, like my example, who a person who's in a wheelchair is at an assisted living, and they get to a point where they are getting too weak to help us transfer them, most assisted livings have a Hoyer lift or an easy stand in their building and can do some complicated medication. But there is a point where a transfer may need to be made to skilled nursing for a number of these things, mixing together or becoming complicated at the assisted living level. So I will say, like I say, if there's enhanced care in a building, more likely that the building can do more for longer. At the building I'm in, there's also this question I would have of, is a person more comfortable when they need that much care are they more comfortable in their own apartment, being left alone behind their own closed door, using the pendant, and I just want quiet? Or when they need that much care, would they be more comfortable? Are they the kind of personality that would want hospital level care when they need more, so that they can hear staff out in the hallway? They know someone's going to be in to check vitals more often. So that your comfort level is part of this too when you get to that very high level of care. And hospice can be brought in anywhere. I'm just going to say, this is not a hospice talk, but hospice can be brought in any independent living, assisted memory care. Hospice can be brought in and skilled nursing. So on top of, which can be helpful to keep someone at a lower level of care if hospice is brought in. So transitional care in the skilled nursing facilities, there's usually a wing of transitional care, and a couple names for that too. So a TCU, transitional care unit, is the same thing as rehabilitation or rehab. Typically, transitional care, if you are in transitional care, it means you've had a health event, you've been to the hospital, and they are sending you to transitional care to try to find your new normal before you can go home. Or you've had a hip replacement, a planned surgery, and you can't quite go home yet because you're still recovering, and you go to transitional care to get back to where you were. So transitional care is temporary, typically for a couple weeks to a couple of months, and it's typically covered by Medicare. So transitional care is most often not a private pay kind of care, but looks almost exactly like the rooms in the nursing home. Typically all the amenities for either nursing home or transitional care, that's the same building, same beds, same TVs, same wardrobes, same chairs. So they look similar. So if you've been to a transitional care, you know what skilled nursing would look and feel like in most cases. I'm going to do one other thing. The difference between assisted living and skilled nursing is a question I get all the time. How do I know if I'm assisted living or if I'm skilled nursing? And really that if I can no longer bear weight on my feet and the complications, but it does take a nurse to do an assessment upon move-in. So if you're at our campus, and in most cases, we always want to place someone at the lowest level of care because it costs less, and we want to keep people as independent as possible. And families should think that way too. So you don't want to over support someone. You want to support them at the level they need. The other thing I'll share too, I get a lot of questions about, well, do we need memory care or assisted living? That's the other big question I get. I just don't know. They seem to do okay with routine. They're not wandering, but they can't remember things all the time. So those are the things we do look for if we're talking about assisted living versus memory care. Can someone order their day a little bit? And we can come in and help with that. We can do escorts to breakfast, lunch, and dinner in assisted living. Can a person stay safe behind their own closed door in assisted living? That's the other big question we ask when we're thinking about, does this person need memory care? And I'll tell a little story about that. So we had a resident who was living with quite a bit of cognitive loss in assisted living. And in most assisted livings, it's a big gray area. So, some people are clear as a bell, and some people are on that journey of cognitive loss, but doing well with routine. They know their apartment, they trust the staff, we're supporting them in just the right way so they can sustain and maintain. This gentleman, though, while he could get to breakfast, lunch, and dinner, he attended activities, was doing pretty well. Behind his own closed door, he decided he would wash his clothes in the sink. Fine, that's a good idea. You can wash your clothes in the sink if you want to. And he would dry them on his light bulbs. Well, our housekeeper found scorched clothing, which could turn into a fire. So that's what I'm talking about in terms of, is someone safe behind their own closed door? And I would echo that at home too. So if someone has some behaviors that could result in something bad happening, leaving a stove on, leaving water running, in a sink that's plugged, that kind of thing where it could be a disaster. That's when we would start to talk about, well, that's why we have a staff. 24 hours a day to kind of be watching for those things and helping. So those are some of the markers I'm looking for. And that question, is a person safe behind their own closed door? The other biggie with your own care is, can a person be their own advocate for their care? So in assisted living, can they push their pendant? Will they remember they have their pendant on? Can they ask for more? They know that, boy, you know, this is getting harder and I really need more help with this. If a person doesn't have that reasoning power to understand that they need more care, then that's another reason to look at either more care or memory care. So just a couple of thoughts on that. How to begin a search. All of these are things that might lead you to the decision that you need, but one of these might pop out as more important for you. So deciding what's most important to you about a facility. Maybe if you're very independent, making this decision all by yourself, you know, you want to be in the same city you've always been in. Maybe you want to be close to family. Maybe you really want a 2-bedroom apartment. So really it's not about, I don't care which one I go to, but it's got to be this, I need 2 bedrooms, or I need a balcony, or I need parking, or whatever. So there could be something very specific. Faith affiliation for our campus sometimes is important to people who move in also, because we have a spiritual component. So we've got staff, we have chaplains on staff, and that has been important for people at our location. But knowing the care that you need could be the thing that leads your decision instead. So maybe it's less about the location anymore. And, you know, I do have an LVAD and I really need to find a place that can care for me. Or maybe there's something else that's sliding scale insulin. Not all assisted livings do sliding scale insulin. So kind of knowing what your care needs particularly are, if there's something extra special about the care that you need. Knowing your financial situation. This is a huge one, of course. Knowing your budget. And if you are needing to apply for medical assistance with the county in which you live, this might lead your decision. So knowing if you need elderly waiver or medical assistance, and what locations have that, because not every location in assisted living memory care will take that kind of assistance, but every long-term care nursing home does in the state of Minnesota, which is different from other states. Ours are all regulated by our state. I think in Illinois, there's private skilled nursing where you're paying privately, but not in Minnesota at this time. What families need to be involved alongside you in the search? And this might lead your decision of location. Well, of course, my daughter needs to be involved. She's my closest person, and she's the one who's going to help me XYZ, whatever it is. So maybe being close to the daughter, it leads the decision. 2 important things, these last 2 bullets, I just want to say a few words about being aware and ready to address your own emotions in the process, whether you are the person who is needing the move or you're the person supporting the person who needs the move. Really staying in touch with the fears, staying in touch with the worry, and on top of that, staying really out there with the joy in this. Maybe mom, I finally get her close to me. And then addressing those in healthy ways. You're going to need an outlet. And mom or dad, if they're your person who's making the move, they're going to need outlets, and you might be their outlet. And just know sometimes someone's going to have to say things. And know that it's an emotional journey. It really is. And being gentle with yourself and each other is important to maintaining a relationship through the journey. Patience is a virtue in this instance too. And really a big thing on my side, on the sales side of things, how does a facility feel? It's a lot like buying a house. It's a lot like picking a college. I've had 2 college students, go off to school and visiting campuses. When you walk in the building, what's the tone of the people around you? What do the residents, what are they wearing on their faces in terms of their own, eye contact with you? And we can't see smiles right now. I was going to say smiles, but with the masks, everybody's wearing masks. But how are people acting with each other? And even the look of a place. So a look of a place can have benefits for a person too. The Martin Luther campus have happens to have a lot of trees, and we're in the woods and we're off the beaten path in a neighborhood. So we have a very quiet feel. But there are places that are close to a Starbucks and walkable to some things you might want to go to a convenience store or pharmacy or something like that. And that might be important too. So the feel of a facility and how it makes you feel is something to pay attention to. Like I said, just like buying a house. So questions to ask. I'm going to start with these questions to ask that I have on this sheet are the same now as they are now that COVID's hit. So same questions, still ask them. Is there a waiting list? Everybody has a waiting list. To be on the waiting list, usually making a deposit that goes toward a deposit towards move-in. And usually waitlist deposits can be requested back if you change your mind. So it's pretty minimal. There's no risk actually involved. You just have to remember you made the deposits. You can ask for it back at some time if you don't want to. But being on a waiting list has benefits because you are a priority person for the community. So the salesperson can't keep track of the hundreds of people who've made inquiry and who we're sending emails to, but they can keep track of the smaller list of people who are definitely, usually if you've made a deposit, that's your priority location. And that's an indicator to the team at that location that, yeah, these are the people who really do want to move in sometime soon, and we need to stay in touch with them. And so there's a rhyme and reason for priority, usually for wait lists, and keeping in touch with people with the next opening for whatever they're waiting for. Another good question, how many times am I going to need to move for changing healthcare needs? And that comes down to, do you have enhanced care? Do you have skilled nursing next door? Does that mean a move? What does it look like when hospice is brought in? So a full continuum care location might be something you're looking for. Many, many, many people spend all their days in an assisted living to the end. And that can happen too if it doesn't get complicated at the end, and if hospice can just come in on top of care. I hear a lot, the goal of a family is, I don't want to have to move mom again. It's a common thing. But sometimes that does need to happen. So kind of eyes wide open about what a place can provide. The cost to make a deposit. So at Meadow Woods, we are $1,500 for the deposit fee to move in. And you would make a deposit 30 days out from a move-in, or within 30 days of a move-in. We wouldn't take a deposit and hold an apartment for longer than that. So we're on the more affordable side of things. So most places have a $2,000 to $3,000 deposit. Some places have for first month's rent, that is the deposit. And you don't usually get those back. That's pretty standard in the industry. It goes towards what the building needs to do to turn the rooms, activities, that kind of thing, to enhance the building. So the process and period of time until move-in, when you're within 30 days of a move-in, that's go time. So at 60 days, if you back it up, 60 days, look, figure it out, what's open, make the deposit at 30 days out from a move-in or less. Location usually needs a week to move you in if you're doing it that close to the move-in time. Most places can't do it within a couple of days because an assessment by a nurse needs to happen also. Putting together a care plan and then bringing in furniture. So there's some moving parts. Can I bring in my own help? Pre-COVID, yes. Post-COVID, mostly yes. So if you have worked, you were in your own home and you had life spark coming in, and you really like the person who's been doing your baths, and you move to an assisted living, you can still have a professional company come in and support you, in most cases on top of or alongside the care at an assisted living. Relatives and other people in your life, this is being regulated right now. They're called essential caregivers. So when you move into a place, the question to ask is, can I be an essential caregiver to help my mom or dad with something, or my spouse? So cost, obviously you want to go over rental rates. Facilities, assisted living and memory care have two parts of pricing. There is a rental rate, so room and board. It covers housekeeping, covers meals, activities, utilities, usually the TV, like direct TV or satellite. And then you have home care. So two parts of pricing. rental rate, home care, and together that's the total cost. So common questions specifically during COVID, we'll move to the next slide. Can I see my mom? Can I see my family? It's important to know right now, if you move in anywhere to assisted living, memory care, skilled nursing, there's a 14-day quarantine in your room upon move-in, and that is to protect the other folks who live in the building and staff. After those 14 days of quarantine, then you can either do visits. Visits are just transitioning right now. So everybody was doing outside visits and they had to be staffed. We had to screen every visitor. Our staff we had dedicated staff for this, sanitizing surfaces as people came and went, and there were 20-minute visits at our location on 5 days a week. The care center, I think, had like 6 days a week. Now that it's cold, we're transitioning to indoors. That's going to look different at every place. So there might be a location inside the building everybody goes, and we're just doing the same thing as we did with outdoor visits, where it's very controlled, it's timed, or it might be that you can have a certain amount of people who can go up to a room, and you have an hour or 2 hours up there, but we are not controlling it quite the same. So there's a few things happening here, and the Minnesota Department of Health just came out with some new guidelines last week that we're still trying to unpack. This essential caregiver thing is still separate from visits. So there's two ways to visit your mom or dad if they move in. One is a visit that has certain parameters around it, and the other is to be an essential caregiver, and that's to come in, and it would be a specific period of time for some specific purposes. So two different kinds of visits, and it would be different people. So an essential caregiver is assigned their role, and then a regular visit might be other folks who are coming in to do a regular visit. So we're all trying to unpack in the care world what this looks like in our own community to keep people safe. These things all stop if there is COVID in the building in a prevalent way. So we're trying to do this as safely as possible so that we can continue to keep doing visits. Can my mom leave her apartment during COVID? Your mom can come out into the building 6 feet apart from everyone else with a mask on, just like at Walgreens. Almost all buildings are restricting residents from leaving the building. So if a person decides to leave a building and it is not essential, so we certainly allow for someone to take their person out to a doctor's visit. Maybe there's a heart specialist or something that is essential. We have to go do this. But if there is, let's say, a wedding and we're choosing to go out because niece is getting married, there would be a 14-day quarantine upon return for the safety of the rest of the building and the staff. So that's how everybody's doing it. That's what's being mandated right now. So just know that. So will residents and family be notified if there's COVID in the building? Yes, in a 24-hour window. That is mandated. Will residents and family be notified if a staff person with COVID was in direct contact with them? Absolutely. Within usually less than 24, I think the 24 hours is, but we do it same day. How often are residents and staff tested? Each location is going to be a little bit different. In our building, we do 20% of the residents and 20% of the staff every week, unless we have a case. So that is called surveillance testing. And if the surveillance testing is working, you might get a case. So recently we had an asymptomatic staff, and how would they know except we're doing surveillance testing? Well, as soon as we know that, then okay, how many more do we have? So then we do an entire 100% resident and staff testing. Nursing homes or skilled nursing locations are being held to a higher standard. So at our skilled nursing, it's 100% testing every week for the staff. And I think residents, it's a percentage. And then based on if we're seeing cases, then it would be all residents if we're seeing cases. So that's how that's working. What other precautions are being taken? Anyone who comes in the building, staff, these essential caregivers, visitors, providers, therapists, anyone coming in the building has to stop at the front desk of any location right now to have their temperature taken. They must wear a mask. They have to have a shield on, and they have to use sanitizer and wash their hands. So hand safety. And then all facilities are doing sanitation of the building. So my door to my office gets sprayed about 3 times while I'm there from 8 to 4:30. And all surfaces where people are touching. The dining room gets its own sterilization. We are doing in-dining experience just for lunch at this point. Breakfast and dinner are still being brought to rooms, but we hope to open the dining room for dinner because it's going very well for us right now. So each location is going to be at different levels of sanitization and kind of where we're at with what we can do based on what's going on in the building with COVID. What's the facility doing to support residents socially and emotionally? I would say in most cases, activities are ramping up. So there was kind of a stop to activities. There was a stop to dining in the dining room we didn't know what to expect early in March. We had no idea. Nobody did. But now that we know more about how COVID spreads and what we can do to support folks and how close we can get to each other and what we can do, and we've gotten creative about how we do activities. These things are all ramping up, and we are getting good with bringing activities back. Certainly the staff are there for the social and emotional support of the residents, and in most cases social workers can be brought in. Does the facility have the PPE they need? That's a good question. We're an Ebenezer facility, so yes, we're related to Fairview. We're a Fairview daughter. That Fairview owns us, so we have everything. If you're looking at Ebenezer, I'd feel safe about that, but that's a good question. The other thing too, the Minnesota Department of Health, I look at their website probably once a week to see what facilities in the metro or in the Hennepin County, but it lists all counties and congregate care settings that have COVID cases. What's interesting about that is we report to the Minnesota Department of Health, so all cases are listed. So a location might look like they have, might be listed on that list of, they've got COVID, and they might have 16 residents that have it. But there also might be a location that had 1 asymptomatic staff. So the list is good to look at, but it's really important to ask about, do you have COVID in the building? And what are you doing about it? I'm going to tell you our story at Meadow Woods. We had 3 COVID cases for residents in March. So very early on when we didn't know a whole lot and we went on total lockdown. We had all the PPE, we were using it. It was a scary time. All 3 of those residents were in one memory care unit. So we could kind of contain it really well, actually. All 3 residents were over the age of 85 and have recovered. So they still live with us. So all that is to say the PPE works. The sterilization, the sanitization works. We haven't had a case for residents since then. We've had some asymptomatic staff. So that's why we've shown up on the list in particular. But we haven't had a resident get it since March, just those 3. So important to know. It is recoverable, even for an elderly person, for sure. All right, so how to shop and move into a senior living community during COVID. Shop online. We don't want you to visit unless we are a top 1, 2, or 3 location and you're trying to narrow it down. We don't want you to bring it into our building. So do as much as you can virtually. Ask a lot of questions by phone and mail. Be in touch with that salesperson. Ask if there's COVID in the building, how many cases, and have them tell you their story about what's going on. Find out how a community is organized for visits. It will vary from community to community and with shifts in the environment. So if a county has more cases, they may shut visits down if it get over a percentage in the entire county. Or if just that location has a few resident cases, it may shut some things down. But they might be able to keep a portion of the building open too, who knows? So find out what's available for dining service and activities. That's going to vary a lot, but things should be opening up as we all have learned more about how to stay safe. Ask to be in touch with a current resident or another family in the building who's having an experience there, so that you can talk with them. What's this really like? What will my mom really experience? Find out about move in and move out guidelines. So moving in and moving out is very different right now. You have a max of 2 hours with 2 professional movers and 2 family, and that's it to get in and get out. So it's fast. We don't want you in the building whole lot. So knowing the policy of the facility to give notice in case you need a change is important. We talked about that. And then asking about the wait list. So I'm going to say one more thing about the wait list. A wait list is important because we have availability right now, but as this thing continues, I see a time when, we're either going to get back to normal or we're just going to start moving up. People are still going to need the care, and we might fill up again and need to work with those wait lists. So being a priority person. So the benefits of moving during COVID right now, there's choice. There is more available to choose from. I will note that we are full in memory care and have been this whole time. So choice in assisted living for sure. Some places may have choice in memory care also because people have been holding off. Move-in specials, I've noticed there's places that are doing move-in specials. So move in now, get so much off. So that could be a benefit. Interaction of staff and other residents may outweigh being homebound. So that was the case before. It's still the case now. Activity calendars in senior living communities are adding things at this point. They are ramping up. We are learning how to do this well. But visit restrictions will keep flexing. So there is still a benefit. There are still activities happening. Senior living environments are largely contained too. That's the other thing. Because residents aren't leaving, we are doing all the sanitization and the PPE. It is much safer than someone who is living alone, but going to Walgreens, going to the bank, going to the grocery store in these environments that are not as standardized as an assisted living. So I think senior livings can be safer. Care support to stay at home. Jennifer is going to get into this with the Normandale Center for Healing and Wholeness, but there's home care, adult day, and the stay by the day option would be a short stay in an assisted living. So I'm going to just kind of keep moving those because we're running out of time. Private payment is typically what's needed to pay for any care. You do have to spend your own money first before you can access medical assistance through the county in which you live. I can talk to people individually about how that works. Planning documents, I just listed some things that are always a good idea to have in a folder for if you're looking at a move-in, and so they are listed here for you. My favorite slide, no way, we're not moving. So it's really important that someone who is maybe looking at needing care be super clear about what their goals are. Why do they want to stay at home? What are the things that are really important to them? And I tell people when I have an elder and maybe a daughter or son in front of me and they're not seeing eye to eye on this, I sometimes will take a moment with the family and talk about maintaining good relationships. It's really important that parents don't frustrate their children and children don't frustrate their parents. And so I can't say that enough, but getting through a change like this can be hard on relationships. And so giving each other a lot of love and latitude in the period of time where you're choosing is important. Exploring home care options, our providers bringing people in is a good way to go. Technology, there's a lot of technology, with the alert buttons. Medication systems, there's automatic medication systems that can be used. And of course, all these delivery services are popping up everywhere. And then Uber, Lyft, and Metro Mobility to get places. And then understanding hospice. Hospice is a world unto itself, but knowing what can be provided in your home is something good to know too. There's a slide with resources that Jennifer, I can share with you. Should you need them, you can ask us about it. But I'm going to hand this over now to Jennifer, who can talk to you about what Normandale Center for Healing and Wholeness can.
Thank you, Amy. Can we move ahead the slides? My name is Jennifer Monroe. I'm the Executive Director of the Normandale Center for Healing and Wholeness. And I noticed on your resources slide, Amy, you listed Senior Linkage Line. And Senior Linkage Line is funded through the Older Americans Act and the Metropolitan Area Association on Aging, which is one of our funders. And so it's very likely if you have your clients call the Senior Linkage Line, they would refer you to us, particularly if you live in the Southwest suburban communities of Minneapolis. So the Center for Healing and Wholeness was formed as a coalition in 1998 with organizations such as Fairview Lutheran Social Services, Normandale Lutheran Church, and Lutheran Brotherhood, and then established as a nonprofit in the year 2000. So we've been around for basically 22 years, providing support to seniors and their family caregivers in the community. Our strategy around supporting caregivers is that research has shown that 60% of seniors get their informal care from family members, friends, and neighbors. And these people are often the first individuals that one turns to when they're aging or when health issues start to arise. So by supporting the family caregivers, we therefore can support the senior and the broader community. We offer a variety of supportive services, resource consultation, and I'll tell you a little bit more about what these are as we continue on. Volunteer and support services, healthy aging and wellness, caregiver support groups and education, general caregiver support groups, evidence-based community workshops, public information education, and we're one of the few organizations that still provide equipment loans. So if you have someone who's in a transitional, managing a transitional kind of health need and they need some durable medical equipment, we have a supply of items that we loan out. A little bit about our model. It's a relationship-based model. So we look to the individual as the lead, and then we build trust and establish that relationship. So as opposed to some type of models where the idea is to serve the person and then not see them again, our model is to develop a long-term relationship. And as those aging or caregiver needs change, we help people throughout the transition. So repeat clients and customers and long-term relationships are actually our goal. And we work on kind of a strength basis where we work with the individuals to identify their own strengths and then to help support action plans to meet the needs as they encounter them moving forward. So we have a team of 3 social workers. Interactions with clients start up with an assessment, and they meet and receive that resource consultation. And then as their needs develop, so identifying information or access to resources that are needed, individual or family counsel or action planning. For example, a family caregiver might want to figure out a way to get the other family members involved to help care for aging relative. And so we will facilitate family meetings where the whole family can come together, and we're kind of an objective party to kind of move along that discussion and help identify action plans for each person so that the burden isn't kind of overly on one family member. And so this ongoing goal setting and coaching continues. And then we refer people to educational programs and supportive services that are available in the community or that we may offer. And that could include virtual volunteers, the individual education caregiving supports, as we mentioned earlier. A little bit about our services during COVID-19. If you could move to the next slide. The community that we serve has arguably been hit hardest by COVID-19. So individuals over 60 are more likely to have devastating physical and outcome effects from the disease, as well as having negative, cognitive outcomes from the disease. So essentially, when Governor Walz announced the executive order declaring a state of emergency in March, we transitioned all of our programs to virtual. So everything that we offered before, we transitioned to offering virtually. So that includes consultation, community workshops, caregiver health and education, the individual and family meetings, volunteer connections, all of that. We've really been surprised and encouraged to see the number of individuals who've transitioned to virtual. And, initially when we did this transition, we called our clients and asked what they needed during this time. And overwhelmingly, their response was social connection. So we We've dramatically increased the number of support groups we offer, the number of community education and workshops offered, and I'll share a little bit about what some things are coming up that people can get involved in. But really, isolation, which was already a critical health issue for seniors and caregivers, has really become a crisis during the pandemic. The issues have really increased for caregivers with a loved one with Alzheimer's or memory loss. Overwhelmingly, those individuals are experiencing loneliness, isolation, seclusion, and that is significantly impacting their physical and mental health. This decreasing socialization and the stimulus from outside world are furthering the cognitive decline for many people, and particularly people with neurological disorders. I mean, if you pair that with increased anxiety and depression, it's just a huge challenge right now for the individuals that we're serving. And so even, caregivers who may be supporting someone in a congregate care community, they're suffering in a different way because of the isolation and disconnection from the person that they love. So just a little bit about some of the things we have coming up and some examples of what we offer. Caregiver education, we offer a variety of different things every month. We have a monthly Saturday education with some of the topics coming up, including ambiguous loss, which is a term to define, when you feel a loss, when there's a change in the person you're caring about, their cognitive or neurological status, the person isn't the same. How do you identify that? How do you respond to that? And how do you support yourself as a caregiver through that transition in order to care for the person that you love? We have the author Ted Bowman coming to speak, and that's on November 14th. And he wrote a book about ambiguous loss. Other topics include navigating determinants of health and music and memory. And so we have a variety of different topics to help caregivers and care receivers kind of live as healthy as possible right now with all the social restrictions. And that includes connecting up through support groups and having a group of individuals to meet with on a regular basis. Powerful Tools for Caregivers is a workshop that we offer 3 times a year. And so that's a 6-week workshop. It's limited to a group of 12 people. So they develop a connection and relationship throughout the 6 weeks. And every topic, every week talks about a different topic of basically identifying and putting into practice self-care. Caregivers often think of themselves last, and that can be incredibly detrimental, as I mentioned before, to their mental and their physical health, as well as the health of their care receiver. We have a whole variety of support groups that are offered throughout the week: Tuesdays, Wednesdays, Thursdays, Saturdays. We have drop-in groups for people who want to just kind of drop in and give it a try, or maybe just have something going on that week that they want to talk through. And almost all of our groups are facilitated by licensed social workers. So once in the group, the individual can develop a relationship and then move on to individual consultation or other supportive service after that. And then the next page just has some other types of programs and services coming up. The one that we're launching now is at the bottom on the right. It's called There Where You Are. And that is basically a program to support caregivers who are in the home over these winter months. So that involves weekly emails of ideas and suggestions to keep yourself and the person you're caring for kind of the cognition stimulated, ideas for conversation and activities. And also it includes mailing out cards and letters that are supportive. We've had volunteers create all kinds of supportive materials that we're sending out on a regular basis. It includes kind of random gift bags. So it's basically a program where if you know somebody who's isolated at home, and you can sign them up, and we will send them on a regular basis materials, either electronically and or printed materials and gift bags and things like that, so that they have something to look forward to and something to engage them, particularly over these winter months ahead. So there's more information, about that program and basically all of our programs on our Facebook page. And this is particularly where we kind of list everything coming up this week. So I've got our Facebook page listed here But you can also just Google us, Normandale Center for Healing and Wholeness. I would just say in conclusion that we are supported through grants. And so everything we offer is sliding fee scale, and any individual who is, if they're eligible for Social Security, they probably fall into the free category. So the majority of the services we provide are free. And so, we don't want financial status to be a barrier for anybody accessing these services. I would just encourage you to check our Facebook page to see what's coming up for yourself or for your clients. And again, know that virtually everything we offer is free. We get generous support from Normandale Lutheran Church, from foundations, from the Metropolitan Area Association on Aging, and connections with Fairview and other organizations that help support us in other ways. So nobody is turned away for inability to pay. And I think we've got some time for some questions about either Amy's presentation about, through this COVID-19 period of looking for residential placement, or if you have questions about supportive services that we may offer, I'd be happy to answer those as well.
I didn't see anything in the chat box, but we can answer a question. If you want to unmute yourself, if you have a question, or use the chat. Jennifer and I are here. One of the most often, the other questions I didn't put on the sheet that I get the most often is, what's the food like at an assisted living? And usually assisted living food is very good. I always tell people when I started working there, I gained 5 pounds because staff can purchase meals at the assisted living. So it's that good that we do purchase the meals at the assisted living. So that's a question I get quite often.
Yeah.
Any thought? Does anyone have any thoughts they want to share? Journey they're in, discoveries they've made as you've done your own looking. Question? Yeah.
Question.
Hi, Ralph.
Hi. How are you, Amy?
Good.
The Essential Caregiver Program under COVID. What is involved in getting that designation, and what does it entail?
Yeah, so each location is doing their own regulation of this. So the Minnesota Department of Health has put out some guidelines about what it could or should look like, and each location does their own determination. So I will say at Meadow Woods, we have been pretty restrictive about who has been an essential caregiver up till, I would say, just a couple weeks ago, where we said, yes, a person can have an essential caregiver if that person was coming in prior to COVID to shower, to do medication, to do laundry, something like that. And we were seeing this person weekly, and really that it has been a big change for the resident because their person is no longer coming in. So we did that restrictively because we had 3 COVID cases early, and we were not willing to take that risk. Since it's getting cold, that is going to open up. And so we have told our families, if you want to apply to be an essential caregiver, please be in contact with our housing director and our director of nursing, and we'll talk through what that looks like, and we'll start scheduling it. And then it comes down to also, an essential caregiver gets like 1 time a week for a period of 2 hours, and they must stay in the person's apartment. So they go directly to some places will say it's 1 person only that is this, and some places will say you can have up to 2 and they can alternate. So it really depends on the location that you're looking at. And we're still trying to define this. So like we're just rolling this out for kind of a larger population because of what the Minnesota Department of Health came out with just a week ago. So,
Amy, I have a question. There was an article on the news yesterday about staffing shortages in residential care facilities, and that the state was getting involved in offering, I think, kind of like a contract workforce or things like that. Could you speak to that at all as far as at Martin Luther Manor? And
Well, the thing I can speak to is we would not be applying for that at our location because we're well staffed. And I think there was a meeting this morning, probably as I was coming over here, that our housing director sat in on this morning to learn more about that. More importantly, if you're looking for a location, that's another good question to ask. Tell me about your staffing situation, or go to their website and look at job openings. What are the postings at this particular location you're looking at, to get a sense of how many nurses are they looking for? Or do I see a lot of culinary? I'm like, oh my goodness, the kitchen is falling apart, you know. So that would be a way to gauge that. I will tell you that our facility, older places that have been around the block, that have kind of some core staff in place, have navigated COVID better than someplace that has been trying to open just in the last 2 years, because their staff maybe hasn't gelled. And the way a lot of care facilities open is they open first with the independent. So if a assisted living has independent living, they'll open the independent living first, and then they'll add the nurses and RAs as they start to fill the assisted living, or as people transition from assisted living to, and they're filling those assisted living and the memory care. So they're building the staff as they're building the resident, so it's the ratio, because you wouldn't be able to pay for a full staff with just, 10 people living in the building if you're a new building, right? So new buildings, that's a good question for a new building. But yeah, I think good leadership and asking about, who owns your building, what company is behind you, is a really good question. Pres Homes does very well for themselves with support. I think Ebenezer's fantastic. So kind of knowing what you're getting into. Yeah.
I have a question.
Yes.
This is Bonnie Foslin. We now reside up in the Alexandria area, which is our home, and it's Douglas County. And we are in the process of purchasing a co-op in South Minneapolis, but Douglas County will probably still remain our permanent address. The co-op will be our second home. But due to all the relationship down in the city, our daughter, etc., in the future, with my husband with his memory loss, they would prefer to have them down in the Minneapolis area. So I'm trying to figure out, how does this work? This will still be our permanent home, but we will have a co-op in South Minneapolis as our secondary home. So I'm not sure how this works. When you talked about county-wise, I thought, oh, now where are we at?
Right. Okay. So what I do, I am not an elder law attorney. I'm going to qualify myself here.
Thank you.
An elder law attorney would be a good person to meet with to sort out a financial picture for going forward for you. That's the best person to talk to, because they know the ins and outs of senior care and how the county can step in. But at a basic level, if you or he needed to apply for assistance with the county to help pay for your care at some point, you have to apply in the county in which you live. So let's say your permanent address is in Alexandria, you're living at the co-op in Minneapolis, but you decide that, okay, my husband is going to move into a care place and we're going to apply for assistance.
Okay.
He would have to be if he's going to stay in Minneapolis, he'd have to be if that's Hennepin County, he'd have to be a resident in the county in which he resides for where he's going to receive that care. Okay. So that could cause a delay, I guess, is what I'm saying, if you have to change your place of residence.
Yeah. So if we have long-term insurance, so maybe that assistant would, we wouldn't have to worry about that at the moment so much as far as placement.
If you can privately pay,
Right.
you don't need to worry about it.
Oh, okay. That was one of
Long-term,
our big concerns. So I
if you can
know.
privately pay, it doesn't matter.
Okay.
Long-term care insurance is taken at assisted livings as payment. You actually front the cost, and the long-term care reimburses you on the backside is how that works. You do have to know what your plan is ahead of time.
Sure. Okay, well, that's very helpful. That was one thing in this meeting that I thought I better check into that and see just how that goes, because we really don't want to leave him up here since the kids are all down there and I would be down there part of the time. So we're in a real, so far so good. And not thanks to COVID, this is happening, but this is what's happening. I'm able to get care coming in up here to maybe keep my sanity for now.
Good.
So that helps. So I think our daughter might be listening in about now too. So but I thank you for all the information today.
Thanks for sharing your situation, your question. That's a good question.
Bonnie, I would just say you can connect with us as you're thinking about your transition, just so you have the support and your family has the support of people to talk to as you sort through these decisions and things. So,
okay.
You know, kind of.
And I think our daughter's been connecting with you down there quite a bit. So.
Oh, wonderful. Okay.
Through all of this, so she would be my best advocate on all.
Sounds good.
So we will. I'm sure we will be in touch at some point if COVID would only go away.
Right.
Anytime in the future, it would be very helpful for everyone. So, all right. Well, thank you.
Thank you.
I'll say goodbye.
All right, Bonnie. Thank you. We have a few more minutes if anyone else has questions or thoughts they'd like to share. Situation they find themselves in, they want to talk through. We will have this presentation emailed out to you for everyone we have emails for. Kate, do you want to say a few closing words? I'm going to mute me and put Kate back on to close us. Okay.
All right, can you see me again? Super. I just want to say thank you again for everything. Thank you, Jennifer, for partnering with us today to provide this breadth of information. And thank you, Amy, for all of the information as well. I think you can see that these two women are really passionate about this work, about walking alongside seniors and families. And, you know, we don't shy away from the fact that these are hard conversations and hard topics. But when you've got a team of people, hearing Bonnie say the importance of her daughter as an advocate, these kinds of things, you need as many people in your corner as possible. You know, there to support you and walk through this. And I think when Amy's stressing just being kind with one another and walking together as much as you can, it's so important in all of this. So thank you. And to know that Jennifer is available afterwards, Amy is available afterwards. If you ever just want to pick up the phone and say, what do I do with this? Or how does this work? Or whatever it might be. Folks that are in this industry want seniors to find the very best place to be and the very best situation for themselves and the right place, right? And so always know that you can call and you can ask questions, and there's no dumb question, and there's no question that, you know, we aren't just about wanting to fill our own building with our own people, right? We want you to find the right place. If that's Martin Luther, great. If that's another community, that's great too. That's our goal. So thank you again so much. As Amy said, we'll send out a recording and the slides so that you have both of those. If you want to share them with another family member, feel free to do that and just kind of say like, I watched this thing. Now I want my daughter to see it too. And we'll watch it together and see what we think about our situation or whatever that might be. So know that's there too. So anyway, you have our contact information you'll have it on the slides. Reach out with anything one-to-one. I know sometimes that's easier when you want to dig into a situation. So thank you again for your time and all of your lovely conversation and input. And we're glad to be together. So thanks again. Take care, everyone. Have a great day.